Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question about dermatology. An 85-year-old lady presents to the dermatology clinic complaining of itchy white plaques affecting her vulva. There is no history of vaginal discharge or bleeding. A similar plaque is also seen on her inner thigh. What is the likely diagnosis? A. Candida, B. Lichen Planus, C. Lichen Sclerosus, D. Herpes simplex, E. Seborrheic dermatitis. Okay, here we have an 85-year-old lady. It means that we have an old lady coming to the dermatology clinic with complaint of itchy white plaques affecting her vulva. We can see here we can think about candida involvement, candida infection, but we can see the plaque on her inner thigh also. It means that the involvement is not candida. We must think about lichen sclerosus. If the patient had only the involvement of the vagina with white plaques, that the choice would be candida. But if the thigh of the patient is involved, we can say that it's not candida, and we must think about lichen sclerosus. Okay, the answer here is lichen sclerosus. Here we are going to explain it. We have lichen, we have lichen planus and lichen sclerosus. Okay, lichen planus is a purple pruritic papular polygonal rash on flexor surfaces and which harms stereo over the surface. We can see oral involvement is common in lichen planus. If the patient is coming with oral involvement, we must think about lichen planus. As we can see here, purple papular polygonal rash on flexor surface or on the wrist of these patients. We can see here oral involvement in the patients with lichen planus. Oral involvement is in lichen planus is common, and here we can see which harms stereo here in lichen planus, and we can see the harms stereo on the patient's mouth also. Okay, and lichen sclerosus. Lichen sclerosus is itchy white spots and typically seen on the vulva of elderly women, as we can see in this patient. In our patient, we can see it, itchy white spots and on her vulva and on her thigh. Here we can see the itchy white spots. Here we can see white spots in these patients, which is their characteristic of lichen sclerosus. Okay, note, candida may cause pruritus and white plaques, but lesions would not be seen on their inner thigh, as we said. If the patient had the involvement of the vulva, white plaques and itchy, but the other part of the body was not involved, especially the patients had some diabetes, or if the patient was immunodeficient, we must think about candida. But if their involvement is in the patient's thigh and other parts of the body, we can think about lichen sclerosus. Okay, lichen sclerosus. Lichen sclerosus is an inflammatory condition that usually affects the genitalia and is more common in elderly females, as we can see in our patient. She is an old lady. Okay, lichen sclerosus leads to atrophy of the epidermis with white plaques forming features. Each is very important in patients coming with lichen sclerosus. Okay, here we can see the patient involvement, the vulva involvement of the patients in different stage. In early stage we have inflammatory stage, and in middle stage we have erosion, blisters, and purpura. But in late stage we have the atrophic and tumor stage. Their lesions can change to cancerous stage, and this is very important for the follow-up of the patients. Okay, features. We said that each is very important in the patients with lichen sclerosus. The diagnosis is usually made on clinical grounds, but a biopsy may be performed if atypical features are present. Usually the diagnosis is on clinical background. Biopsy also can be done if there are atypical features, but usually the diagnosis is on clinical background. Management is usually with topical steroids and emollients. Follow-up is very important because the increased risk of vulval cancer is high. That's why a follow-up is very important for all patients coming with lichen sclerosus. Okay, it was a short explanation about the lichen sclerosus, about their 85-year-old lady coming with the complaint of their itch with white plaques affecting her vulva and her thigh. Thank you for your attention.